Hello and welcome to Streamlined. Today we're joined with Stephanie Dorwart, the CEO of Altius Healthcare Consulting Group. Stephanie, thank you so much for joining me.
Thank you, Kyle. It's a pleasure to be here, and I look forward to the conversation and discussion today.
Yeah, thank you. Stephanie, I want to start with a statistic that you told me about, that 700 hospitals are at risk of shutting down. Can you give me a little background on what's happening in the industry and when that number became personal to you?
Yeah, absolutely, Kyle. 700 numbers of hospitals, that are at risk of shutting down, the number is large. And if you think about that in 50 states and the number of hospitals per state, it's an enormous risk that everyone faces. What's happening in the industry right now are a lot of competing forces dealing with reimbursement challenges. You hear a lot of news right now about the potential Medicaid cuts. There are a lot of situations with Medicare, insurance companies, and just shortages of staff, increasing travel rates. All of these pieces are really building a situation where it's becoming harder and harder for rural hospitals, especially in smaller community hospitals, to operate at a margin level that allows them to sustain operations. So we have what would be considered a compression of the financial situation to what's really considered a point that 700 hospitals could shut down within the next 2 to 3 years, maybe 5. When did this become personal for me? It's been personal for a long time, Kyle. When I was younger, much younger, right around 1999, 2000, hospital in my hometown, Citizens General Hospital, the hospital that I was born at, was going under similar financial pressures. And at the time, the hospital was forced to actually consolidate with a larger healthcare system, Allegheny Health Network, still operating today within the Pittsburgh region. But that hospital, unfortunately, eventually shut down. And I can remember the ripple effect of friends whose parents lost their jobs, families who were forced to drive a lot farther for care. The fact that the heart of the community, where everyone congregated, where a lot of restaurants depended on the support, was gone. And it really wasn't just a hospital that closed. It was a loss of identity for the New Kensington, Pennsylvania area, a loss of safety, a loss of access, a loss of, services there. And more recently, for those in your audience that have followed the news, the hospital in Philadelphia, Crozer Chester, has also been in the headlines, and they went through a similar fate. And the frustration that unfolded there, same story, different zip code, when that hospital shuttered was really very disturbing because during a press conference with, a lot of congressmen, a mother pulled up with a baby in the back seat who had stopped breathing. And luckily, there were paramedics on site at this hospital that were able to actually stabilize the baby, transfer the baby into an ambulance, and transport it to another hospital. But the mother wasn't aware that the emergency department at Crozer Chester in Philadelphia area actually closed.
Wow.
And I won't go into details about the joint ventures that led to that, and the situation that really did that. But Philadelphia, that county in Philadelphia right now, is down to 2 hospitals out of 5. So they really are in what would be considered a situation that's heartbreaking because they're a care desert now. And you would never think that would happen in an urban setting,
Right.
in an urban environment, just in a suburban area outside of Philadelphia. So why is this meaningful to me? Why does it matter? Because hospitals everywhere are in a position to make different decisions and do something about it. No hospital in any community needs to shut down. But in order to be in a different position, you need to be able to proactively decide what's going to be our future and act fast enough to influence the changes.
Yeah, and I totally, what resonates with me, I'm also from a small town where there are only a few major employers in town, and one of them is our hospital. So I can only imagine what the impact would be for those loss of jobs would be a domino effect to the community and the businesses around it. Absolutely. So you're talking about not just the employees, but their contributions to the community. Wow, that's amazing.
Yes,
Man.
it's very disturbing. And, our goal with a lot of other partners that we have in the industry is let's keep as many of these hospitals open because every community deserves to have high quality care at an affordable cost.
Absolutely. Well, now that we kind of have an idea of how you got involved and kind of the business goals, can you tell me, for those who don't know Altius, how would you describe what you do without using the word consulting?
Out using the word consulting. All right, so easiest way to describe what Altius does is Altius creates a culture of excellence. And we
Mm,
do that through workforce optimization, productivity improvement, performance improvement. So what does that mean? We educate leaders to better understand productivity, better understand performance improvement, better understand their operations so that they can have that culture of excellence. And as we're doing that, Kyle, we elevate them to have clarity and confidence. A
mm,
lot of managers and leaders within healthcare are great clinicians. They've been great at their job. They've been tapped on the back and promoted, but then they're not taught how to lead. So we
right.
really help them to have that confidence and influence so that they can do a better job and implement changes. So ultimately, we empower the leaders to become a force multiplier for their hospitals by making sure that every single department becomes the best possible department that they can be. So we roll up our sleeves, work side by side with them, work with them on anything that they need to do to realign their workforce, ignite their culture, claim their financial strength, and ultimately activate the organization's excellence by activating the leaders and working from the inside out.
Absolutely. Interesting as you say, it's like as great employees are rewarded and put in leadership, there's wonderful training on how to become whatever your role is within the hospital other than leadership, right? And so it is an interesting knowledge gap that goes into how do you train somebody who's amazing on the floor to all of a sudden become an amazing manager. So it sounds like your team steps in to support that.
We do, and there's an analogy that I really enjoy to use. We build the muscles within the leadership team. And if you think about going to a gym, if someone goes to the gym and all they do is work on leg day or all they do is work on their biceps, they're going to
Sure,
become very, very unbalanced. If
sure.
it's only legs, they're going to look a little bit awkward. The top of the body is going to look a little bit. And it's the same thing with leadership. If all they're doing is focusing on improving their clinical skills, and they're not focusing on all of the other emotional components, all of the situation of being a strong leader. How do you have difficult conversations? How do you resolve conflicts? You're going to have an unbalanced leader. So we build that muscle throughout the entire leadership structure for each leader.
Yeah, love that. Now, in a previous conversation we had, you mentioned that productivity often gets weaponized in healthcare. Can you tell me what you mean by that and what the alternative is, since productivity is kind of the goal here?
Absolutely. So oftentimes, productivity is ignored until an organization's in a distressing situation, either financially, culturally, something has caused them to say, we need to change and we need to change fast. And whenever that happens and productivity is brought into broken systems or brought into financially distressed hospitals or brought into organizations with damaged cultures, it gets reduced down to a spreadsheet. It
Mm,
gets reduced down to we need to cut FTEs and we need to know what those FTEs are by tomorrow. We need to slash hours. We need to reduce costs. And when you're looking at it from a desperation situation, it becomes weaponized. And it also can be a situation where it's used as punishment in a way to say, you're not a good leader because your productivity's not strong. And that's not leadership, Kyle. That's panic. And
right.
when productivity gets weaponized, when productivity becomes a threat, leaders get disengaged, employees get disempowered. So, what's the alternative? We really use productivity as a mirror, as a way to shine a light on the situation and help leaders and organizations and hospitals and healthcare systems use the data to understand where systems are broken, to
Mm,
understand where processes have opportunities to improvement, to understand where potentially there are access issues, where there might be high no-show rates, where there might be cancellation issues. Because productivity is not a sign that their people aren't strong. It's a sign that something needs fixed, something needs addressed.
mm,
Productivity is just data. The data shared doesn't tell someone that you have a good leader or a bad leader, but it does shine a light on opportunities. It does shine a light on broken processes. It does shine a light on struggling teams. It does shine a light on misaligned resources. So the alternative to using it as a weapon, as a hammer, as a mallet, is use it as a mirror, use it as a way to identify where you have opportunity. Because when you do that, it's a truth-telling tool. And when you have a truth-telling tool, leaders use that as a way to identify what they can do better. It uncovers blind spots. So all of a sudden, they're not afraid of their productivity reports. They're not afraid of the comparatives. They start to elevate by saying, okay, what can I do to influence change? What's one lever that I can pull? How can I redesign what we're doing to improve the patient care? And that changes everything.
So it sounds to me like when you partner with hospitals, it's a top-down approach that you guys work with the leadership team to help them kind of get control of their data points so that they can start thinking more strategically. What is that always the approach that you've used top down? Like what made you, it's just interesting that it's leadership teams are the focus instead of the employees as a whole. Can you just speak to that in terms of why it's the leadership team that drives these big changes?
Yes, that's a great question. And leadership's so important. So I'm going to use a phrase and then I'm going to directly answer the question. But
Sure.
productivity produces positive results, but it cannot produce positive results in a negative with a negative mindset or in a negative culture. It can't produce positive results when there's a toxic environment. So why do we start at the top? Because culture's going to cascade throughout the entire organization. We can't fix what's broken if everyone's complaining, if everyone is criticizing, if everyone is complacent. So we start with leadership because we need to focus on fixing the leadership teams to make sure that the leadership is clear, the leadership team is connected, the leadership team is working together. Because if the leadership team's out of sync, nothing's going to stick. We can put productivity targets in place, you can even roll out action plans, but if the leadership team's not working together and each individual leader is not committed, it's not going to stick long term. It's going to become a one and done solution. So the first place we start is leadership, and it's always that top-down approach because leaders can influence everything within their departments. So when we walk into the hospital, we understand each unique leader, whether they're a manager, a director, a vice president, a C-suite executive, understand what motivates them, what drives them, what makes a difference to them, why did they get into healthcare in the first place, what do they want to achieve? And by doing that, we can actually understand what motivates them and what will give them momentum to change and make their radiology department the best radiology department in the hospital. And through those hard conversations and teaching them to lead with vision, the entire organization rises. And when the entire organization rises, yes, from the top down, but also from the bottom up, because those leaders are responsible for influencing and empowering and enrolling their teams,
Right.
you're really setting the tone for that, productivity improvement, for that cultural improvement.
Understood. All ships rise with the tide. So if you're able to, it makes sense that the fewest pegs that you can, I guess, have the biggest impact, right? In terms of pushing downward and rising all together. Now, I know there's probably misconceptions when hiring a consultant, and people here, there obviously consultants have a massive breadth of services that they provide. What would you say is the biggest misconception or a common misconception that hospitals have or hospital leadership teams have when it comes to hiring a consultant?
I think hiring consultants and coaches are probably two of the biggest misconceptions, not just in healthcare, anywhere. And I think what we often hear is that you have to wait until you're in a desperate situation to hire someone to come in and help, that
Mm-hmm.
only broken organizations need support, that we only need help if we need something that's fixed, that we need to fix. But the reality is all organizations, regardless of where you're operating from, can benefit from an outside resources that can show you things you might not be aware of. So the misconception is that you need to be broken, you need to be damaged, you need to really be in trouble to hire support, when the reality is you can hire someone to make you better at all times. Everyone needs a coach in life. Every organization needs a coach in life. And if your hospital or healthcare organization desires to become a championship hospital, a championship team, a top 100 hospital, all top 100 hospitals have coaches. They have consultants.
Sure. Sure.
They have the guidebook. So the misconception is that you have to wait. And the other one is that, the consulting services or bringing someone in is a sign of weakness. And the biggest message I'd like to drive home is it's actually a sign of strength. And as the CEO, as the CFO, as the department director, manager, you're not expected to know every single decision or every single solution. You can bring in resources to help guide you. At the end of the day, if you are able to produce the best possible results, provide the highest possible care at the lowest possible cost with an engaged staff, bringing in consultants and coaches to help you get to that goal is well worth it. So what I really would love to drive home, Kyle, is the strongest leaders don't do it alone. Championship teams don't do it alone. Top 100 hospitals don't do it alone. They build a bench of resources and bring in individuals, catalysts, companies that can help raise the bar and reach their goals.
Yeah, I think you're totally right here. We all have our blind spots, that we don't know what we don't know. And I think, as you were saying, the best leaders are continuously learning. And so if you have a team that continue to sharpen your skill, sharpen your saw so that you can continue to grow within that role, it does make sense. I think that you really drove that point home. That was great insight there. Now,
even I have blind spots, so I think we all have blind spots.
Yeah, as you talked about that, I was thinking of my own management styles. I'm like, okay, yeah, I gotta time for me to hire a coach. Oh man. Now you mentioned, we talked about when we spoke before, your goals. Whenever you partner with a hospital, is a 10-to-1 ROI, so return on investment. Now, as a real world success story, what does that look like?
Yeah, so an observation that I've made over time is that productivity tools, productivity systems, productivity targets, even the consulting engagements surrounding it are thought of as budget items. They're thought of as a line item on the budget. We can't afford that. It's not in our budget. We can't add a new system. It's not in our budget. We don't have the money for that. But the reality is that productivity engagements, tools, targets, they're a multiplier. And our goal is to make that a multiplier with that 10-to-1 return on investment. We actually technically average a 17-to-1 return on investment. And we've had clients that have been as high as 33-to-1. Now, what's a real world success story? The one that's coming to mind for me right now was a hospital that when we first started working with them, they were losing $9 million a year. Earlier, I talked a little bit about that toxic environment. When you walked into this organization, no one would look you in the eyes. There was a palpable heaviness that it just felt heavy because they were so distressed.
Yeah.
Leadership wasn't visible. No one was paying attention to what was going on. And it became a great engagement because we started from the top down. We worked with every single leader. We brought them to the point that they were excited again about their work. They had a roadmap to reclaim their greatness in their departments. And they knew that it wasn't about us cutting resources. It was about us helping them. And as we worked through that, we returned to the right coverage. We reduced overtime. We worked with the leaders to improve processes. And it became a much different environment to where when we were walking out, everyone was smiling, everyone was greeting you, everyone was excited. So it's important to note,
Wow.
The return on investment isn't just financial.
Sure.
It's cultural. And when leaders learn how to manage their departments to targets and set goals and drive improvements and lead their teams through change, everything improves. And that improvement drives quality, and it drives engagement, it drives revenue improvement, it drives retention. It drives the ability to change. So what does a 10-to-1 return on investment? It looks like a completely different organization and a $9 million shortfall that transitioned into a $6 million gain. Now that doesn't happen overnight, but it does happen with slow and steady engagement changes, slow and steady time. And the impact, if you stay consistent with it, slow and steady over time, one foot in front of the other, one change in each department every single month, you can swing $15 million. You can swing $12 million. Productivity is not an expense to justify. It's an investment to multiply.
Hmm. And you even kind of said something that I was curious, even as you said this, as I think of this transformation where we go from what feels like a sad workplace, right? That's kind of lacking the uh, a cultural unity and just a culture of joy, enjoying work and enjoying being there. And we've all walked into places that felt that way, and we've also walked into places where we feel greeted and we feel welcome. What And I'm sure every client is different. You can either maybe an average client or this client. Like, how long was it that you worked with this client or the average client to achieve these kind of results?
So the average situation, in the beginning is about a 6 month process
Hmm.
to achieve that initial cultural change.
Okay.
And then it becomes a situation of maintaining and retaining it and building upon it. But
Sure.
that initial period, within the first 3 to 6 months, you can have dramatic cultural change. And quite honestly, we tend to see the energy shifting because everything's about energy. You might just mention it, that you can feel
Yeah.
that. And it's energy. You can see that energy shift within 1 to 2 months. And it starts department by department. You'll have those champions that, really rise to the occasion, leaders that really understand it and they embrace it immediately. And then you use those wins to really sort of drive the momentum with other departments. So it's typically about a 6 month process to really get everything moving in the right direction. But then from that stage, Kyle, it's about continuing the accountability, from
Sure.
always looking at what you can do better. You asked earlier, what might be a misconception about productivity or what might be a misconception about why consultants use. I think a misconception about productivity that applies to this direct conversation is that it's a one and done situation. We're going to bring someone in, we're going to correct the productivity, and then we're going to go about our business and just get back to the way we do things here. When done correctly, productivity becomes part of the culture. It's just simply what you're always operating with. And it's not about doing more with less. It's about making sure you have the right processes, the right resources, the right environment. And that really makes the difference.
It makes me think of almost like habit forming. It's like, what does it take to develop a new habit? What does it take to change your behavior and in turn change the energy of a space as a leader? Where surely you start with the why and we get motivated as to why we're achieving this and where we want to go and create our own individual goals. But I could see it as your team needs to ensure or help ensure that the habit sticks when you walk away. And that takes what? It was something anywhere from 3 to 8 months or something, depending on the habit. I'm just shooting from the hip here. There's obviously like research out there, but it feels like a positive energy almost becomes a habit of people as they continue to go in each and every day to maintain that accountability. Just kind of thinking out loud there, I guess.
I absolutely love that you tied that into habit forming. And yes, it does take, I think, between 3 to 8 months. What is it? Atomic Habits,
Right.
one of the most
Yeah,
popular
that's the one.
books.
Atomic Habits. Absolutely.
Yeah,
Yeah, that's
takes
great.
and so that's when the magic happens, whenever that culture, that energy becomes habit, and that's where hospitals can really transform.
Right. And so then that kind of is when it starts trickling into new hires as they enter into this whole new culture, continue to perpetuate and champion that new kind of energy that everyone's bringing to it. Interesting. It's like a systemic change of the organization itself in the end is what we're looking for.
It
Yeah.
is. And, one of the biggest line items on a financial budget that no one sees is the cost of turnover and the cost
Right.
of losing your employees. And we don't see it on the budget, so we don't pay attention to it. But
Right.
every time someone walks out of an organization, you're using their intellectual capital, you're losing all of the time it's going to take to train someone else. And if they're an A player, I think there are studies that show that A player, if you consider them to be at 100% and they are able to do so much, it will take you at least 18 months to get someone new that you bring into the organization up to 80% of where they were.
Yeah.
And if
Huge
you,
financial toll.
yes,
Huge financial toll.
yeah.
Uh, yeah, that's incredible. Steve, well, I won't even dive into it. There's a quick snippet. This is something aside I think you'd find interesting, Stephanie. Steve Jobs I saw an interview with him recently where he was talking about finding A players, and that A players transformed Apple. It's like what he built Apple off of, and is getting a few A players together who like to also play with A players, how it can completely change an organization. It only takes a handful of those. So if you imagine losing, that's like losing the backbone of a business if it's a higher level A player is no longer satisfied. So
Absolutely.
anyway, check that. I thought that was really interesting when I saw it as somebody who's in management. Cool. Now I know you work with both rural and like larger hospitals. What's the biggest difference in how they approach change?
So I think, rural hospitals and larger systems definitely have some key differences, and those differences really influence how they approach things. Number one is when you're talking about a rural hospital, they actually can move faster and make decisions quicker. But
Mm,
that's because they've been operating in environments where they've had to do that over the years. Their financial outcomes change quickly, their market dynamics change quickly. They need to know how to respond quicker, faster, and be more nimble about the
right.
results. So rural hospitals approach change by, looking at what can we do to share resources? How can we influence change by scaling, by having individuals cross over departments and provide services in multiple areas? They might look at what they need to do to recruit someone that cannot just work in environmental services, but maybe work in environmental services, nutritional services, and cross train across a lot of different areas.
Got it. Yeah.
Systems are much more complex, and they tend to be a lot more focused and diligent and thoughtful about the decisions that they make, because their decisions are going to impact a lot more employees and a lot more areas. So it typically takes them a lot longer to have change. And in fact, they tend to focus on having everything planned out, meaning larger systems, one of their biggest downfalls at times can be that they want the perfect plan instead of just working towards progress. Where rural hospitals, in many cases, they're just struggling to stay alive. So they take that next step forward and just take the next step forward and keep taking steps forward, knowing that on the end of those steps is going to be a positive outcome. Where larger systems, there's a lot more bureaucracy, there's a lot more thought. It doesn't make it wrong, it's just a different environment where they tend to have the entire plan in place before they're going to execute it. Rural hospitals, a lot of times, they're creating the plan as they go.
Sure. Yeah, yeah. I guess like any, it's kind of like what you think of traditionally as a startup versus a, larger company that's got the bureaucracy. It makes sense where as you're getting going and you're in panic mode, done is better than perfect. Keep it going. Build the plan
Yep.
while you're flying it. Does that change how long you engage with these two different? I mean, one's obviously way larger than the other. Is there I guess, some sort of correlation in terms of how long it takes for the result because of how long it takes for the, I guess, initial start? Does that make
That's an
sense?
It does make sense. That's an interesting question. So the answer is it doesn't take any longer from the time we're engaged until the time a large system or a rural hospital
Okay.
achieves results.
Yeah.
That framework from the time the contract signed to the time we start until the time you'll see the dollar signs or it starts to your bottom line, it's the same. The difference is we've had contracts, with rural facilities or, smaller communities that have gone from the first conversation to contract signature in 3 weeks. In fact, some have probably been 10 days. Larger systems, there tends to be a request for information, a request for proposal, multiple meetings, multiple different individuals are involved with the decisions. Again, because you have so many people that are involved strategically, you need to involve all the key stakeholders. So those decisions tend to take 3 to 6 months to decide who they're going to work with and what they're going to do. So there's a longer period before actually getting started. So it's not how long does it take to produce results. It's the decision making process that usually is different.
Understood. So by the time you start, you've already ironed out more of what this is going to look like, and they're bought in on the whole process. And so they're hitting the ground running. It just took longer to initiate.
Exactly. Exactly.
Understood. If a hospital leader is listening right now and feels stuck, where do you suggest they start?
Well, if they're listening and they feel stuck, I say just make one move forward. But in order to do that, you really need to start with a simple question. And the simple question is, what's working and what's not working? Where are we effective and where are we maybe pretending that we're effective?
Mm,
You need to start with understanding authentically and being honest with yourself, honest with your team, what's broken, but also acknowledge what's working. So understand and be honest without getting overwhelmed what you need to do. And then pick up the phone and call someone to talk about it, whether it's a colleague, a mentor, walk down the hall to an employee, another department director. If you're stuck, you want to acknowledge what's working, what's not working, what do we need to influence, what needs to change, and then start to have conversations around that item that needs to change. Don't focus on correcting everything all at once. Pick one item that's not working. Pick one thing where you're stuck, one place where you're stuck, and change it. And if you're not sure where to move forward, you're not sure how to change it, pick up the phone, reach out to someone, not necessarily for a proposal, not necessarily for an engagement, but just to have a real conversation, just to get best practices, learn what other organizations are doing. Because when you do that, you can lead yourself and your team out of that fog. And once you're, moving through the fog, you're starting to see things and you make that one change to get unstuck, the next change is much easier. So it's just one foot in front of the other, really.
I've heard you say that a few times because when we were talking about transition or change from a whole, you're like, it'll start with one department, it'll start with one team, and then one after another. And so I'm hearing that kind of as a recurring theme that it is just one decision, execute, and then we'll make the next one foot. Because if you think of it, it's like, I guess it's the old saying, how do you eat an elephant? Sometimes when you look at everything going on, it feels overwhelming. I mean, I look at my own checklist, and my takeaway from this is I might start trying to just write down one thing at a time that I'm allowed to see, because we all, I think, kind of can get overwhelmed when it comes to systems breaking down, and what does it mean when multiple systems are breaking down. And I love the idea of get your win and then start getting momentum one at a time.
Yeah, and the other thing, Kyle, too, is if you make too many changes all at once, you're not going to understand which of those changes was positive and which of those changes is negative. I'll give you a real world example in healthcare.
Sure.
Let's say the emergency department understands that they don't have the right staffing. So they look at the staffing schedules, they determine that they need to have more resources on the night shift and maybe add another resources in the middle of the day. And so they make 4 or 5 different schedule changes.
Right.
And it blows up. We've made these 5 schedule changes, everyone's burned out, it's not working. So now we assume that all of those decisions and all of those changes didn't work. So we go back to the old schedule and we completely revert. And then we're afraid to make change again. Whereas if we would have just added the resource in the middle of the day to see if that helped and trialed it for a week and said, okay, that works. Next, let's change. We don't need as many people on the night shift. Let's take off that extra resources on the night. Okay, check. We've made that change. That works. And you systematically start to make one change after another. Now you can go down your runway and pivot when you need to without completely getting stuck.
That makes sense. And instead of batching them all together and not having any data to drive anything back.
Yeah.
It makes a whole lot of sense. Now, I've got one more for you here. I mean, I can tell by talking to you that your job energizes you. Is there a moment recently that reminded you of why you love this type of work?
Oh, I love this work. As you can tell, I just get so excited about helping every single hospital and every single client that we do. But there definitely is a moment that I can think of recently that really got me super excited. We were called in to a hospital client to do a leadership journey. They've been a productivity client of ours, for multiple years, and they wanted to really energize their team and provide more leadership. So we were doing a 3 hour leadership retreat, and I'm not going to give all the details away, but we play games, we build things, we roll up our sleeves and have fun. And it really lit me up because for the first time in years with some of those leaders, I saw huge smiles on their faces,
Mm,
bigger than I've ever seen. They were excited. They were talking about this is the spark that we needed. This is the purpose. And it's not that that organization was stuck. They weren't, but it just helped them take the bar. And this is actually a hospital that's already considered to be one of the top small, short-term acute cares in rural America. They get awards all the time, but they're actually looking at how can we become even better. So they're already top quality scores, top retention, but they want to get better. And it energized me because I could see that room lighting up and every single leader realizing their purpose, realizing their power, and learning something new that they were going to take back to their team.
yeah, that's amazing. I can imagine being able to work with people so hands-on and seeing the change happen, or I guess the spark ignite so quickly is certainly something that's contagious, and that's great. I think the work that you're doing is amazing. If there's someone who wanted to work with Altius or just learn more about your approach, where should they start? How should they reach out to you?
I think the easiest thing to do is just start with, a conversation and reach out. They can visit us at altiushcg.com and, do a contact us form, or honestly, they can find me on social media, follow Altius on LinkedIn. They can find me on LinkedIn. They can reach out to us on Facebook, Twitter, I guess X.
Yeah,
Never will call it anything but Twitter, but
I'm the same. Yeah, totally.
yeah, but the easiest place probably is LinkedIn Cal or altiushcg.com and direct message or do a contact us form. And we do free consultations for anyone. And if nothing else, you'll get, 30-minute strategy session, a lot of best practices and some tips you can take away. And, that helps us to provide service as well.
Absolutely. Well, Stephanie, thank you so much for hopping in, sharing your insight, and sharing your passion. It's always amazing to talk to people who love what they do, and it comes across. So, those of you out there who are listening, give Stephanie and her team a call if you are struggling with your productivity and ready to make your hospital a better performing machine. Stephanie, thank you so much for your time, and I'll talk to you soon. Thanks for joining us.
Thank you, Kyle. It was a pleasure.
Cheers.